So we now have dozens of states forming a coalition of the sorts to sue the Trump administration for rescinding billions in healthcare funding to the state and local levels. We did a story on this, I believe, last week. Um, just real quick, before we actually get into this AP article, I'd like to show you. This is as of 2021. It's probably more now. Um, but this is a breakdown of state and local expenditures. As you can see, number 3 is health. Now, number 2 is elementary and secondary education, and 4 is higher education. Two things that is a part of, the Department of Education that we also talked about that is also being shut down and cut. So this is the top one, two, three of four, 3 of 5 items on a state's funding, like where most of their expenses go, I should say, goes towards those items. And Trump has actively cut all those items, making it a bigger burden on the states. So, and this will always proportionately hurt red states more, by the way, just saying. So from the AP, states sued Trump administration for rescinding billions in health funding. Let's get into it. A coalition of states sued the Trump administration on Tuesday over its decision to cut $11 billion in federal funds that go towards COVID-19 initiatives and various public health projects across the country. Now, we did a story on this last week. Obviously, COVID-19 is not a huge thing anymore. It's kind of out of style. So that money was then being used towards the prevention and research and just tracking the spread of infectious diseases. It's going towards hiring nurses. It was just going towards other general healthcare projects, which is always good. Healthcare, good. Expanding healthcare, good. Attorney General and other officials from 23 states sued in federal court in Rhode Island. They include New York Attorney General Letitia James and Colorado Attorney General Phil Weiser, as well as Kentucky Governor Andy Beshear, Pennsylvania Governor Josh Shapiro, and the District of Columbia. The lawsuit argues the cuts are illegal and that the federal government did not provide rational basis or facts to support the cuts. The attorneys general say it will result in serious harm to public health and put states at greater risk for future pandemics and the spread of otherwise preventable diseases and cutting off vital public health services. The lawsuit asks the court to immediately stop the Trump administration from rescinding the money which was allocated by Congress during the pandemic and mostly used for COVID-related efforts such as testing and vaccination. The money also went to addiction and mental health programs. Slashing this funding now will reverse our progress on the opioid crisis, throw our mental health systems into chaos, and leave hospitals struggling to care for their patients, James said Tuesday in a news release. The U.S. Health and Human Services Department, which began serving employees dismissal notices on Tuesday in what's expected to be a total of 10,000 layoffs, said it does not comment on the ongoing litigation. And here's also a chart now of just some of the lawsuits against Trump's executive actions. Pretty neat list we have here. Feel free to pause and look at that, or you just find this article. Like, there's a great breakdown of everything. Anyways, HHS spokesperson Andrew Nixon pointed to the agency's statement from last week when the decision to claw back the money was announced. The HHS said that it will no longer waste billions of taxpayer dollars responding to a non-existent pandemic that Americans moved on from years ago. So yeah, again, this is what they consider, their words, waste, taxpayer waste. This is the waste and fraud that they care about, which it isn't waste and fraud. So when you hear Elon or Trump or your average mega idiot saying, Elon saved us so much money, bro, and cutting so much waste. Yeah, this is the waste that they're actually cutting. Okay, and they phrase it in a way where people will be like, oh yeah, obviously we don't need that anymore, completely ignoring the fact that the money was going to other healthcare programs now. And yeah, but no, that's taxpayer waste. Again, I always go back to this point. You can see the Trump administration and the GOP's entire agenda in their budget or their continuing resolution. both call for billions of dollars of increases to defense spending. Defense spending. What the fuck? Defense spending. And that includes, obviously, Pentagon, military, border security, mass deportations, etc. And then billions and billions of decreases to what they labeled as non-defense programs. So that's where their priorities are. If they actually cared about managing the deficit and what they say they care about, then they wouldn't be increasing funding to military and border expenditures. No, they just hate any kind of program that helps the average person and love anything that's related to defense. Clearly, I don't wake up. Donald Trump does not care about you. He does not give two shits about you, and you need to realize that. Not saying that Democrats necessarily give a shit about you, but I'd rather take a party that does nothing than a party that actively destroys our federal government. Call me crazy, call me insane, call me a lunatic. Local and state public health departments are still assessing the impact of the loss of funds, so the lawsuit points to the clawback, putting hundreds of jobs at risk and weakening efforts to stem infectious diseases like flu and measles. Yeah, not to mention that we're recovering from a bird flu outbreak, and not that it necessarily went to humans. I think there's only one case, a couple cases, if any, regardless, and measles, which is currently setting records. So yeah, great time to cut health funding. Not that there's ever a great time to cut health funding, but it certainly isn't now. The Minnesota Department of Health said it sent layoff and separation notices Tuesday to 170 employees where positions were funded by recently terminated federal grants. State agency also said 300 more workers were at risk of having their positions eliminated and that it had rescinded job offers to nearly 20 people. The agency said the layoffs and separations are a direct consequence of the federal government's cutting more than $220 million in previously approved funding. Yeah, and like I said, stupid Republicans will look at this and be see these, and maybe even Democrats, maybe everyone to a point. We see this as just numbers. 170 employees were just, recently terminated. 170, yeah, they just a number, but that's people, man. That is human beings who just lost their livelihood. And 300 more now have to worry about it. And then people who had job offers. Imagine if you had a job offer and you were happy. And maybe you burn a couple bridges with your last employer. We all want to do it. And then this happens. You're just ruining people's lives. Not only the workers, but also obviously the people, hundreds of thousands of people that they serve. And yeah, it's just waste and fraud and abuse, bro. And Republicans on Reddit are man, you see, they just keep on sucking the government's teeth. You give them an inch, they take a mile. Oh my God, shut up. These people are so dumb and short-sighted. They don't think of the consequences for any of their actions. They want to run the government like a business. The government is not a business, and it should not be ran like a business, okay? Jesus Christ, man. We are working now to figure out how much health of this critical public health work we can save and continue, Minnesota Health Commissioner Brooke Cunningham said in a statement. The sudden and unexpected action from the federal government left us with no choice but to proceed with layoffs immediately. California could lose almost $1 billion, according to a statement from the State Attorney General Rob Bonta's office. That money supports a number of public health initiatives, including substance use disorder prevention programs, vaccination efforts, and bird flu prevention. Health officials in North Carolina, which joined the lawsuit, estimate the state could lose $230 million, harming dozens of local health departments, hospital systems, universities, and rural health centers. At least 80 government jobs and dozens of contractors would be affected, according to state health officials. There are legal ways to improve how tax dollars are used, but this isn't one of them. North Carolina Attorney General Jeff Jackson, my goat. I know him from TikTok. He was a representative, I believe, and he ended up getting gerrymandered out of existence, and now he is Attorney General in North Carolina. Yeah, I know him from TikTok because he is very transparent about things going on in the House. He also got a lot of heat because he kind of got he built his platform and his following, I think mainly through TikTok, and then he voted to ban TikTok. So people weren't happy about that. But regardless, my goat. Immediately halting critical healthcare programs across the state without legal authority isn't just wrong, it puts lives at risk. Already more than 24 COVID-related research grants funded by the National Institutes of Health have been canceled. U.S. Centers for Disease Control and Prevention data from March shows that COVID-19 killed 411 people each week on average, even though the federal public health emergency has ended. So yeah, it's still killing people, by the way. But no, they don't care. Yeah, I think that's it for that article. Yeah, so I don't know how else to present it to you, but this administration doesn't care about you, dog. Like, wake up, and stop listening to the same garbage talking points that Fox News, Elon Musk, and Donald Trump will spew out. They are intentionally lying to you. They are lying to you. This isn't waste. Like probably 95%, if not more, of what they have cut is not waste, fraud, or abuse. They know how to frame it and portray it in a way that makes it sound like it's wasteful or fraudulent. But yeah, if you actually get into the meat and potatoes, they're just lying. Like, please just research this stuff. That's all I can ask. Like, you don't have to take me at my word for it. But yeah, like, do the research, okay? Just do the research. Do the research. Anyways, let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below, and if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.